Welcome to the X-Series capnography module. The X-Series has multiple sampling cannulas available, making it appropriate for use in intubated and non-intubated adult and pediatric patients. Cannulas are available for both short and long-term use. The X-Series unit uses the Iridian microstream filter line and Smart Capna line side stream systems to monitor CO2. The systems draw small samples of gas from the patient's airway via a nasal and/or oral cannula or airway adapter and pass these gases through a solid-state infrared sensor that measures CO2. The Iridian microstream filter line set is intended for the CO2 monitoring of intubated patients. Before attaching the airway adapter to the breathing circuit, verify that the adapter is clean, dry, and undamaged. Replace if necessary. The microstream system can be used for CO2 measurements on intubated and non-intubated infant, pediatric, and adult patients. The microstream technology sucks a small sample of the exhaled air into the X-Series where it is analyzed. Microstream sampling lines are designed for single patient use and are not to be reprocessed. Do not attempt to clean, disinfect, sterilize, or flush any part of the sampling line, as this can cause damage to the monitor. Dispose of sampling lines according to your standard operating procedures or local regulations for the disposal of contaminated medical waste. The Smart Capna line nasal and nasal oral cannulas are intended for monitoring CO2 in non-intubated patients. Oral nasal sampling cannulas are especially valuable for patients who are prone to mouth breathing, since most of the CO2 is exhaled through the mouth. If a standard nasal CO2 sampling cannula is used on such patients, the ETCO2 values and capnogram displayed will be substantially lower than the actual CO2 levels present in the patient's expired breath. The displayed capnogram is not affected if the patient talks during measurement due to the Iridian Smart Breath Detection algorithm. The monitor also auto-initiates the zeroing process when a change in operating conditions detected, such as ambient air temperature or barometric pressure. In addition, when an occlusion is detected, the device will purge the capnography sampling line on its own. Press the CO2 key to activate or deactivate capnography. As soon as capnography is activated, the capnographic waveform automatically appears on the screen. Respirations, which are measured through changes in thoracic impedance, automatically transitions from impedance pneumography to capnography measurement. CO2 values can be displayed in millimeters of mercury or kilopascals.